Dr. Collins. I appreciate everybody coming in and spending time with us tonight. And the biggest thing I want to accomplish tonight is actually to have you learn something. And so hopefully with my presentation here, I'm going to tell you a little bit about how I got into Lifewave, how I started, where I'm at now. I've only been with the company maybe 5-6 months. And then I'm going to go into research, because one thing that I do is I do research. I've been published, and I do lecture around the world on this research, and also the instrument that I developed. And I'll just talk briefly about it. But the instrument I developed, and why I'm so intrigued with Lifewave, is because it actually treats the spine with frequencies. So I've been developing this since the early 90s, and now it's so common to read a lot of published articles lately about sound therapy. So sound therapy or frequency therapy, I'm going to use those as AKAs, but that's what I'm going to talk a little bit about today. But before I start that is because I've been published with research, and I've talked to many, many people about research. Some people don't understand really what research is. So what I'm going to do is just break down real quick about what no research, what clinical research would be, and what peer review research would be. So go ahead and go to the next slide, if you would, Stacy.
Absolutely.
Oh, it did not. Oh, there you go. And what I say with this is all research is not the same. So if you see the pyramid right there, you can see it says no research, it says clinical research, and then peer review research. And then I put an arrow of invest. What I mean by invest is your time and your money. So that's very important for everybody. So when I look at these three levels, or three different types of approaches, when you have no research, what that means is, go ahead and click that one more time. That means you're not really going to want to invest too much in something with no research unless you understand or trust the person that is actually presenting the product. So if you have a product and there's absolutely no research behind that product, it's really a trust situation, whether this person is lying, is not lying, or even making the claims that they made. So this is when you go into no research with the product, you maybe want to question if you're really going to waste your time and money on that. Go ahead and click to the next. But then if you look at clinical, now clinical, I do a lot of clinical, and also Lifewave has done a lot of clinical. So clinical is excellent. I love it, and I think it's absolutely needed. But with clinical, it's still going to be biased. And why I say that is because I've done a whole bunch of clinical on my machine that I developed. And with this machine, I'm biased towards it. And there's no way I cannot be biased. I have to be biased because I love this machine so much. So if I'm an inventor of anything, there's of course going to be bias towards that product. So the clinical research is very good to read, but realize it's a biased opinion. Go ahead and push the next. But if we look up at the peer review, now the peer review, that is what it means is that your research goes from clinical and you submit it into the journals. Now what the journals are the peer review journals. They call it peer review because those are my peers. So what I'm doing is I'm submitting my paper to the peer review. These peers on the editing board have no connection into the product. So they're not getting paid financially. They're not being bribed in any way. So they're going to look at this paper and they're going to decide, is this biased? Is it not? Is it good research? Is it not? So if it's not biased and good research, what they're going to do is publish it. So when doctors say I'm published or I'm peer reviewed or I'm journaled, what that means is that they got through their peers, and this is really true good research. So I tell everybody this because a lot of people think all research is the same, but it's not the same. The clinical and peer review is by far the best to go off of your time and money to put in that product. So that's why I kind of go through those slides real quick. Go to the next one. So if we come to the
hang on one second, Doctor.
Oh, yes.
Yeah, and I want to re-screen share. Someone has decided to draw all over that one for some reason. I don't know how that happened, but go ahead. We're good now.
Okay. So now we'll go into David Schmidt. And everybody, you know David Schmidt because he owns the company, and he's also the creator of this wonderful technology. So what I did is I went and the beginning of the Lifewave, why I got into it. So I gave the outline of where I'm at, the frequency adjuster, and then also the researcher. So when I look at that, then I got approached about 5 months ago by a practitioner that I really, really trust a lot, been knowing her for about 40 years. And when she approached me and said, you have to try these patches. At first, I get approached by a lot of people. So I said, yeah. And I kind of blew it off a little bit. But then I said, give me 2 months and then I'll see if I like it. So I used them for 2 months. And I wanted to see if anything changed. And I didn't look into the science. I didn't look into what these did or anything. I just got a basic review and I tried them. Now, I am blessed because I don't have a lot of symptoms. But one thing I did notice is that within the first 2 weeks, my energy was very, very smooth and even. I didn't have the up and down anymore. And then what was even better after the third and fourth week is my focus. My focus was so more exact. Usually I get in the zone a lot, but maybe 5 days a week, 4 days a week. And everybody knows and understands what that zone is. Because when you're in that zone, I mean, life just doesn't go wrong. And you can think sharp. Everything clicks like you wouldn't believe. Well, I'm in that zone a lot more wearing these patches. And the patches that I started with is just 39 and 49. That's it, So I started with those patches. Now that I did them for about a month, I was really intrigued. So then I started digging deeper and deeper into what this patch is, because the explanations I got wasn't scientific enough for me. I wanted to dig deeper. So I went in a little bit deeper and I started just reading the publications. Now we're going to get into GHK in a little bit, GHK copper, and I read about that and that intrigued me. But then I went deeper and I didn't get the questions I wanted answered, so I just went right to the patents. So he has a whole bunch of patents, and I'm so impressed with these patents. But I read a few of them. I didn't read all of them, but I read enough to understand what he did and how he made this. Because I call myself a frequency nerd. So I love frequencies. I love reading about them all the time. So when I heard it was frequency, I wanted to see what's going on. How did he create this? So if you look at this slide right here, with that ladder-looking thing on the left, right there where Dr. Stacy's circling, that's a ladder if you look twisted, okay? They call that a double helix. It looks just like our DNA. But he created this, and this is not the DNA. This is actually artificial. And he can make that out of any material he wants, depending on what he wants to accomplish. So once he has the ladder there on the left and he twists it, then he brings it into a circle and connects the ends. So then you see that circle right there. That's exactly what he has, or what he made. Now with this circle, then he wraps a whole bunch of different wires around it, depending on what voltage, what frequencies, what electromagnetic field he wants to use. So whatever he wants to create that frequency, what's going to happen is he knows his little trade secrets there of how to create whatever frequency he wants in the center of that circle there. Go ahead and switch to the next one. So what I did here is I just put 432 hertz. Now, I don't know the numbers, though that's his trade secrets, and that should be his trade secrets, because he understands what frequency he needs to do what he's going to do to the body, okay? So that's where I just put 432, and if anybody knows about frequencies, 432 is a very magical frequency. It really is. It's a cell regenerator and all that. So that's why I put that in there, but that doesn't mean he does 432. I don't know the frequency he uses, but I use this as an example so you guys can understand this is how he does it. But remember, if you have a frequency, you got to have voltage, okay? And what people don't realize is we are voltage. Our body is voltage. We call it heat, we call it energy. All this stuff comes off, but it's voltage. So with this system here, you got to have an on and off switch. So what he created here is when you bring it close to the body, in your body energy field, guess what? That's electricity. And when that's electricity or voltage or power, it's going to turn that patch on. So it's really fascinating that his ingenious thinking that he worked this out where he needed a power pack. He used us as a power pack. So what I tell my patients now is don't carry these in your pocket, and don't carry them all around you if you have a whole bunch of them, because they're all on right now. And when you take them away from your body, they're off. So you have to remember that and tell people, because these patches only last for so long, because the heat of our body will destroy them after a while. And that's why the 12 hours also. So that's the technology and science behind it. But then my patients, when I talk to them a little bit deep into this with the presentations, they always say, well, that all sounds great. And it's neat frequency. I mean, it's neat technology. But what's a frequency? What the heck can a frequency do to me? I listen to music. I have a good time. It makes me in a good mood. But what does it do to me? So this is why I went a little bit deeper into the science. And we're going to go deep into the history of sound healing. So I tie this back to the good old Aborigines, the oldest culture people on Earth. Okay, now they say about 40,000 years ago, they use this one instrument called the diggergadong. You know, it's such a funny name. But this instrument here, when they use this instrument, it's hollowed out of very specific wood, and they do cycle breathing with their diaphragm to make a very deep frequency. But the frequency is always that same rough frequency. And what the Aborigines said is they did this because it heals bones, it heals cuts, it does pulled muscles, it heals illness. And they would claim that. So we look at our scientists today and say, yeah, that's just hocus pocus. They didn't know what they were doing. Well, guess what? I have two articles right here. If you look at them, those are published articles. Now, remember what I said about published research. Published research is a lot more, I guess, powerful, you could say, than clinical. Well, these are published research that weren't too long ago. And what does it say? It says this instrument, when played, it absolutely decreases stress. It absolutely generates cells. It absolutely creates healing in our body. So this is one example of just sound. What does sound do? It does a heck of a lot to us. Go ahead and go to the next one. So then after the Aborigines, I go right into one of the cultures that I love to read about really a lot is the Egyptians. Now, the Egyptians were by far probably the most advanced, I guess, culture, if you read about them in the ancients, that dealt with frequencies. But what they didn't call it frequency, they call it toning. So if you look up toning in the Egyptians, you cannot believe what they did with toning. I mean, they did healing, yes, but they also did a lot with spiritual work. They did a lot with a whole bunch of other things with this toning. So way back in the Egyptians, they knew that sound was real powerful too. Next slide. So now we look at the Tibetan monks. A lot of people know about the Tibetan monks, and they were really isolated for a while, but not too long ago, they started to let scientists in. Now, the Tibetan monks, what they use with their frequency is they use the bowls, they use the chants, the gongs, even the bells, but they know specific ones to do specific things. What the monks said is, yeah, stress decrease, health, and all that. So this is another published article right here that the singing bowls for sure changes mood right away, and it's for well-being. And again, another good scientific article right here, a published article showing that what they claimed right back then does come true. And what's neat about this publication here, if you read it, the people that did a lot of meditations, they got very good results. But the people that knew nothing about meditations and got this treatment, they got better results, which is real interesting. And I'm really not sure why that happened. They don't know really why. But the people that weren't experienced got even better results than the people that were off of this healing. So I thought that was real interesting there. Next one. So now this gentleman right here, now you can see he lived from 451 to 536. So that was a while ago. Now he wrote a book. Now the book he wrote, in this book, it talks about 6 main frequencies that he used to help heal the body. Because his book was one of the very first books out there talking about, you know, a medical book in China, and then also about how to do long life, a long span of life. And one of the treatments, again, was frequencies. And again, this was a long time ago. Next one. So now we come to the ones on this continent, the Native Americans. Now, the Native Americans, they were the last real culture that really used a lot of sound. And what they use sound for is for physical healing, but also spiritual healing. So when they hit the drums, when they did the flute, their flute was a big one with chants. They did very, again, specific frequencies. And what does this do? This stimulates healing. So again, all these cultures, way back from 40,000 years ago, all the way up to the Native Americans, consistently used sound. And it's proven with peer reviews that now we go back and study how they did it back then. It actually does regenerate cells and does what they claim it did. Next one. So now we get into the science behind the patch. Now you know about the frequency. Now you understand the history of why frequencies are so important. But now you look at the patch, and I'm going to talk about the X39. And the reason why I talk about the X39 is because that patch produces, has our body produce a real good peptide that's called GHK copper. Now, GHK copper, if you've never really dug into it, really does absolutely amazing things to the body. But he has figured out, David Schmidt has figured out in that patch what frequency is actually going to stimulate in the body. And when we go into GHK copper, it is really impressive if you read about it, the benefits this could do. Go ahead, next one. So now we go into, David Schmidt has a lot of clinical research. You can go to that one website. Correct me if I'm wrong, Dr. Stacy, but it's startx39now.com. I believe that's what it is. I've been there many times. And if you scroll down to the bottom, there is a lot of clinical research. He even mentions the patents in there and everything too. But the clinical research, I love browsing through it. Remember, it's still very good, very, very good for you. But to have that clinical research, but to get published is the next level. And that's what this slide is. So if you look at these two publications, this is right from the patches. And one of them says, for sure, this patch, without a doubt, stimulates GHK copper, for sure. So now we know when we wear that patch, that will go up in our body. That will be stimulated in our body. And we're going to talk a little bit about the benefits of that in a second, but you're going to see that is proven for sure in peer review. But then we go to the next one, and the next publication, sure, it says the GHK copper goes in there and so forth, but what does it do? It actually helps with metabolism, helps with a lot of different, and you can see these products that it produces in the body. And the percent and how high it comes up in the blood is absolutely phenomenal. So if you have not read these publications, I do encourage you to read them because it'll give you so much more confidence behind the patch. And now that I've been on the patch for, I don't know, 5 months now, I won't stop. I won't stop at all. I think they're wonderful. They've really changed where my focus, also changed my energy. And I really like this. And as I dig deeper into the science, because I've only, like I said, 5-6 months been in this, so I can't wait to get even deeper and deeper into it, which I will do. But everything I've read a lot on X39, everybody in my clinic should be on X39. Because X39, as I tell people, it's not just treating a problem. It's not treating a disease. What it's doing is actually making your body regenerate itself to the positive, not the negative. That's what's going on with the X39. And it's doing with scientific proof that this GHK copper is definitely being stimulated by that patch. And the more you read about this, the more you're going to see the benefits. Go ahead and go next slide. Now, the benefits right here, of course, wound healing, the infection control, the hair growth, the skin. The skin is really good with GHK copper. And then anti-cancers, even just overall health. So that being said, and those claims, it's a general patch that, like I said, is so good for the body that I truly feel every patient should be on that. And that's the science behind that right now. And hopefully that little presentation I gave here will show you guys a little more of why this truly works. Because this isn't just hocus pocus. This isn't just somebody standing on stage saying, hey, this is going to work. I can pull the science in, and now I understand why I feel the way I feel.